topic we're going to discuss, now we're going to go into insulin therapy. I'm going to talk about the two different classes of insulin. Got it, Price?
Yes.
Okay.
Thanks.
Okay. So, who can tell me what basal insulin is? What's basal insulin? Why would you be giving someone basal insulin? Okay, let's see. Basal insulin is your intermediate or long-acting insulins that are absorbed slowly and give the body a slow, low level of insulin to manage blood glucose levels between meals. Why would we want to do this? What are we looking to accomplish by giving someone basal insulin?
To get the sugar in.
And are we looking to do it quickly or?
No.
Over a period of time, we want to keep the sugar manageable.
Excellent. So it's intended to mimic the body's natural low-level, steady background release of insulin. And later on we're going to discuss specific basal insulins. But again, for those of us that do not have diabetes, this is what our body does. And by giving someone basal insulin, you're hoping that you can replicate that. Okay. What about bolus insulin?
Short
Okay. And how would you define it? Why would you be giving someone bolus insulin?
You want immediate result. The patient's blood sugar is high.
Okay. So according to the ADA, it's actually an extra amount of insulin taken to cover an expected rise in blood glucose. What are some events that can happen throughout the course of a day that would cause an expected rise? Think about your insulin orders, and it might be a little bit more difficult being night nurses. Think about your order sets. When do we give things to cover expected rises?
Before meals.
Before meals, great. Excellent. Often given related to a meal or a snack. Okay? Okay, so now we're going to talk about the different types of insulin. What are the different types of insulin? You already mentioned some of them. Short-acting, intermediate-acting. Long-acting, what else? Two others. Is short the shortest? Rapid acting, regular, which is short acting, intermediate acting, long acting, and your pre-mixed. Okay, and then we're going to look at all of these and what we have on formulary here at New York Hospital Queens. Okay. So what are the three actions of insulin? When we look at any type of drug and looking about the route and why we would give a particular drug, what are we looking at specifically? What are the three actions we would be looking at for a drug? Well, when I mean action, you're going to look at a particular aspect of the medication. So think about, why would you give something IV versus PO? Work fast. So what does that mean? So what is that when you're thinking about when it's going to start to work? What is that called?
Absorption.
What did you say?
Absorption.
Onset, peak time, and duration. Remember these things? These are things, and when we discuss the types of insulin, this is what we're going to be looking at, the types of insulin with these sets of actions. Okay? So, let's define the actions of the insulin. What does onset mean?
Start.
Right. When does it start to work? So the textbook definition, the length of time it takes for insulin to reach the blood and begin lowering blood glucose levels. Again, how fast is it going to work? Peak time. Go ahead.
The amount that, the time that it takes for the insulin to reach the very most effective level.
Excellent. Excellent. So when is the insulin at its strongest? The peak time during which insulin is at its maximum strength in lowering blood glucose levels. Okay, duration. How long is it going to work? Right. The length of time in which insulin continues to lower blood glucose levels. And again, as we're looking at each of the different types of insulin, we're going to define what the timing is. But before we do that, we must remember something. Insulin is considered a high alert medication. So what does that mean? As per policy 8020-127, a high alert medication or high alert meds are defined as drugs that bear a heightened risk for causing significant patient harm when they are used in error. The Joint Commission recommends that healthcare organizations emphasize drug classes and specific medications that are associated with increased adverse events and patient harm when used improperly. And you have to be aware of all the different high alert medications in the hospital, which can be found in the policy. So what are some things that we do in order to ensure safe delivery of insulin? Think about your order. Are there any approved abbreviations for insulin? When you see the orders, how do you have to see the orders? You see 5, can you see 5U?
Units.
No, you have to see units. Why? What can a U be mistaken for?
CCs.
CCs? What else can it be mistaken for? Think about if someone goes all the way around a little too far on their U. It could be mistaken for a 0.
Yeah.
So then you end up giving 10 times the dose you initially intended. Okay? What about how are the vials stored? Think about where the vials are in the refrigerator, and think about how they're stored in the refrigerator. What should they be stored in? The egg crates.
Oh,
They're inside the egg crates. They're separate from all other medicines. They're separate from each other. Okay? What about if you have to set up, for those of you, so everybody can set up an insulin infusion. Where are you getting that insulin infusion from? Are you mixing it yourself?
Pharmacies.
Pharmacy. Pharmacy mixes it. Pharmacy dispenses it. Okay? And then when you set up any drip in the hospital, as RNs, what is your responsibility? Double check. So you're verifying the rate, and as you double check, and then what do you have to do in Eclipsis?
Double signature.
Right, there's your co-signature. Okay, so these are double check systems. Okay, so say now let's go back to sub-Q. Your patient's ordered for Novolog. You're about to dispense it. You go to pharmacy and pick up a new vial. What do you have to do to that new vial?
Label, dates that expire.
Right, and what is that label? What color is the label? Orange. It's an orange sticker. Must be used by. When does insulin expire?
28 days.
28 days. Or the manufacturer's expiration date, whichever comes first. So make sure when you get your vial, you're also checking the manufacturer's date. 9 times out of 10, you're going to have a vial that will expire by manufacturer standards later than 28 days. But in case you don't, make sure that you've taken a look at that. Okay, so now we're going to take each of the different types of insulin and we're going to define the onset, peak time, and duration for each of them.